Hi, everyone. Thank you so much for joining. I'd like to introduce Dr. Kian Karimi, a board-certified facial plastic surgeon, as well as founder and medical director of Rejuva Medical Aesthetics. He's very involved in many minimally invasive modalities and teaching engagements throughout the country and the world. And I'm very excited to hear what you have to say, Kian. I always learn a lot from when you give lectures, so take it away, please.
Okay, awesome. Thank you guys so much for joining us for this really special InMode webinar. Thank you, Dr. Diane, and thank you to everybody at InMode for inviting me to do this. So I'm going to give about a 35 to 40-minute presentation focusing on Morpheus8 and kind of telling and sharing my techniques that I use on the face. And then we're going to have a 20-minute question and answer moderated by Dr. Diane. So if questions come through, please understand we'll answer those at the very end. And of course, this will all be recorded for you for later use and viewage. So Morpheus8 has become an integral part of my practice. Like Dr. Diane said, I'm a facial plastic surgeon, but half of my practice is surgical, half of my practice is non-surgical. So I have a busy med spa here in Los Angeles. I have 4 extenders ranging from RNs to ARNP, PA, and Morpheus8 is definitely the most utilized device in our practice, and we use it for a lot of different ways, and I want to share some of those ways with you today. So I want to give a little background. A lot of you are familiar with Morpheus8 or are familiar with radio frequency microneedling, and when I was looking for radio frequency microneedling devices, I went through everything. I trialed every single device out there, and I ended up actually purchasing Fractora because this was before Morpheus8 was available, because I recognized that it was the most powerful modality out there. But my extenders were having a little bit of difficulty with it because of the pain, and it's very technically oriented because there's 2 poles, and so patients didn't really love it. It was not the most comfortable. I mean, there are ways you can do it that is tolerable, but when Morpheus8 came, my extenders were like a little bit scared, but once they started using it, and now they absolutely love it because of the way that it's grounded on all 4 sides of the tip. There really is minimal arcing or discomfort to the patient. So basically, the indication for all radio frequency is for electrocoagulation and homeostasis. So electrocoagulation basically is coagulating tissues, heating tissues to the degree where something will happen. And that's something that we're looking for is neocollagenesis, but also for treatment of scars. And the cool thing with Morpheus8 is that with certain depths, we can actually get subdermal fat remodeling and a little bit of fat reduction for areas that we want to do that. And I'm going to talk specifically about those protocols and how we do it. So this is kind of our all-in-one go-to for fine lines and wrinkles. You can use it for the whole face, or usually we'll do it for around the eyes or around the mouth. Scars and skin irregularities. So we use this for acne scars, we use it for traumatic scars, or even surgical scars. It's phenomenal. If someone's just looking for maintenance, for skin tightening, you can also dial this down and use the settings that I'll share with you today for improvement of skin tone. And this, of course, can be used on the face, neck, and body, but I'm going to focus on the face today. So, as we age, we all know what happens. We lose our skin elasticity. We're starting to see fine lines and wrinkles. But, this is not just aging skin. In fact, we use Morpheus8 more for facial slimming, facial contouring, a lot of times in conjunction with other modalities that you may or may not use, like Accutite, FaceTite, or BodyTite. But even if you're just doing Morpheus8, it's a pretty powerful standalone modality. So Morpheus8 uses fractional radio frequency to heat the tissues, and I think there's a nice video that shows that. Each of those little needles will then penetrate the skin at the depth that you set, anywhere from 0.5 millimeters if you're using a resurfacing tip, but for the regular Morpheus tip, anywhere from 1 to 4 millimeters of depth. Now, 1 to 4 millimeters of depth, if you think about that, the skin thickness varies depending on where you are in the face. It can be as thin as 1 millimeter or half a millimeter around the eyes. It can be as thick as 3+ millimeters in the cheeks and the mid face. And again, it depends on, you know, male, female, skin thickness, etc. But if you think about it, 3 to 4 millimeters, you can actually get all the way through the skin into that subdermal region, and that's where you can really start to see powerful effects of the Morpheus. When I do laser resurfacing, for example, with like an erbium laser, which is my favorite one that I use, I'll go usually, you know, 200 to 300 microns, maybe 500 to 600 microns if I'm doing really heavy resurfacing. That's still, you know, not even a millimeter. Whereas with the Morpheus tip, you're going much deeper than you can with the resurfacing laser, which is why it's so powerful. But the downtime is a lot less than a resurfacing laser because the tips are coated. And I'll show you some histological slides of that. So the range that we want to be in terms of temperature is right in that 50 to 80 degrees Celsius. Beyond that, you start to get denaturation and you start to get scars and you get burns. So this is a very controlled, safe way to deliver energy. And this really shows it very nicely. So here, this is in a pig skin. You see when the needle penetrates, the tip of the needle is where the Morpheus is actually delivering the energy. So the tip itself is coated up until the very sharp tip of it. That's where it's delivering energy. Here, before where the tip has just penetrated through the skin, you can see it's just simply a mechanical penetration like a regular microneedling. So that's why it heals so fast, because distally, where it's deep and where it's submerged, that's where it's delivering the energy. And this will make sense to you when I share my protocols for why Fitzpatrick types 4, 5, and 6 skin, I don't use more superficial needles because I want all that energy to be delivered deep. And so that's really the key. So these are 24, there's the regular Morpheus tips, and there's a new Morpheus tip I'm really excited to share with you today, which is going to be smaller and more for targeted smaller areas, called the Morpheus Prime. But for the regular Morpheus tip, you have 24 sharp polymer coated needles. So they're coated. So if you guys use the Fractora or are familiar with the Fractora tips, these would be like your 24 coated tips. So we have multiple treatment depths that we can customize with one tip, and that's exactly what I do in my practice. And you can either do a single pulse, which is called cycle mode, or you can hold the gun and have it go in and do 2, 3 pulses, which is called stacking. Okay. So this is what the LED bar looks like. It's a really easy to use interface. The depths will say, you know, face, periorbital, or body. That corresponds to 2, 3, and 4 millimeters. You can actually dial it down to 1 millimeter now with the new software upgrade. And with the resurfacing tip, it's less than a millimeter. It's about a half a millimeter depth. So between cycle and fixed mode, I was using fixed and doing double and triple stacks more frequently in the beginning, but I was finding that I was getting more healing and downtime. I like the healing and downtime for this, for my light protocol, to be about 2 days. For my aggressive protocol, which I'll share with you, I will tell patients that it'll be up to a week, particularly if I'm combining it with other modalities like AccuTite or FaceTite, where I'm going under the skin. But for a pure Morpheus treatment, you really shouldn't be more than 5 to 6 days of downtime, of looking a little swollen and red. So again, even though the penetration can be up to 4 millimeters, because of the dispersion of the heat from the tip of the needle, you can get a thermal effect up to 5 millimeters. And it's epidermal sparing, so you really don't get any heat or injury to the epidermis. And of course, you're only going to use one tip per patient per treatment. Okay, so this is the kind of the full gambit now. The Morpheus Prime, which is just being rolled out now, is the new tip. But the original, which is the one I'm going to be talking about, which is the one that we use primarily in our practice, you can see what that looks like here. The resurfacing, which has been kind of the newer addition, I will kind of at the very end, when I'm doing treatments, especially if I'm looking for fine line improvement around the eyes or around the mouth, I really like the resurfacing tip. Now, of course, you have to recognize that that is resurfacing, so you are now delivering heat to the epidermis and to the superficial dermis, and so you just have to select the right patient for that, and also let the patients know they're going to have a little bit more swelling in that area. The prime here, you can see, is a little bit smaller. There's only 12 micropins, so this would be good if you're using the smaller target areas, like just if you're coming along the nasolabial fold or coming along the jowl and you don't want that larger square there. So that would be really nice when that comes out. So let's talk a little bit about the treatment protocol. Again, you want to select the proper patient, and I am going to go through some of the contraindications because I think it's important to understand who you shouldn't do this on. The patients, of course, you want to have a nice, clean, dry face, and then I'll talk a little bit about the numbing protocol as well. We do kind of test the tips before we use it, make sure that it looks good. All the numbing cream has to come off really well, and then if we're doing anything perioral, we will have our patients take 500 milligrams of Valtrex. If you have a higher risk patient or someone who has a history of post-inflammatory hyperpigmentation or PIH, you can do a test spot, although I haven't found necessary to do that because I know the technology so well now. So let's talk a little bit about highlights of contraindications. Okay, so contraindications mean these are the things that you want to pre-screen your patients for and who not to do it on. So anyone with a pacemaker or an internal defibrillator, that's a general contraindication for any radio frequency technology. What about fillers or neuromodulators like Botox? So that's not necessarily a contraindication. The only thing that I will caution you is that if you're going to be combining modalities, I don't like doing fillers and Botox on the same day as I'm doing my Morpheus8 for a couple of reasons. Botox or Jeuveau or Xeomin or Dysport or whatever you use, any neuromodulator needs to precisely go into muscle. So anything that could potentially move that neuromodulator after you've injected it will lead to potential spread in other muscles that you don't want, and so that could give you side effects that you don't want. In terms of fillers, if you're performing fillers very deep, like on the bone, theoretically you really shouldn't have any issues. However, if the fillers are more superficial and you're delivering heat past the skin, you could potentially dissolve the filler or make the filler go melt faster. Obviously, you want to make sure nobody has any worrisome skin lesions that would require a biopsy. We don't do this on anyone that's pregnant or breastfeeding, and then everything else is kind of common sense. This is we depend on your immune system to heal for this. So if you have an immune issue, if you have a healing issue, or if you truly keloid and those types of things, then you may want to think twice about doing something like this because it really we rely on an immune response to properly heal. Accutane, just like any other laser, is a contraindication 6 months prior. And then of course over tattoos and whatnot, you want to be careful as well. Okay, so let's talk a little bit about anesthesia. So we use a 23/7 lidocaine tetracaine mix for these. Topical anesthetic can be applied for 45 to 60 minutes. And so it just depends on if you're doing a light protocol or an aggressive protocol. Now, if you're doing an aggressive protocol, I will be very liberal with nerve blocks and field blocks, or sometimes even nitrous gas. And so that can really be your friend. For the aggressive protocol. So let's go a little bit and talk about settings, okay? Because I want to share my settings.
Morpheus8 radio frequency microneedling to go through the skin to really maximize tightening that network under the skin and also the skin itself. So we can adjust it to the depth of penetration between 2, 3, and 4 millimeters of depth, and we can precisely put how much energy we're going to put. So we're going to go 4 millimeters here, and 4 millimeters is definitely enough depth to get not only through the skin, but just right under the skin as well. So again, we're just going on the numbed area, a little bit of overlap, and that's it. Over the next 4 to 6 weeks, we're going to expect significant tightening that will actually last for years.
Okay, that's it. Oh wow is right. So we can use this for facial slimming. We can use it for the skin texture as well. So here you can see for the neck.
And newest radio frequency microneedling devices on the market, and has quickly become one of our most popular and requested treatments here at the office. In this patient, I'm using it to rejuvenate the neck to improve fine lines, wrinkles, texture, and tone. Morpheus8 can go down to different depths, so I can actually use it to go deeper if I want to actually remodel the fat or to have some fat be diminished, particularly under the chin area where a lot of people have a little bit of extra fat. It is also great for lines and wrinkles around the mouth, and these are traditionally very hard areas to treat. Morpheus8 will typically be done in a series of treatments, and we usually space these treatments anywhere from 6 to 8 weeks apart. The treatment itself takes anywhere from 10 to 30 minutes, depending on how many areas of.
So this is really cool because you can customize. So if I'm doing a submentum or a neck, if someone has a little bit of fat there, I'll turn it to 4 millimeters, do a couple passes, and again, I'm going to share my specific settings with you later on in the webinar, and then I'll dial it down where I don't necessarily want fat loss. So down here, like below the cervical mental angle, I won't go deeper than 3 millimeters, and I'll definitely do 2 millimeters as well to really focus on the skin. This is a cadaver specimen showing what the Morpheus looks like here, and the important thing is that you have good coupling. So you want to really make sure that the pins penetrate. So you want to make sure that it really kind of is flush. And here I'm just showing that the effects, especially in the lower eyelids, can go fairly deep. And so this is a very versatile radio frequency microneedling. So this is just talking about good coupling. So you don't want it to bounce off the skin like this. You don't want to see that because you'll potentially cause injury to the epidermis, and you could cause arcing, which can be painful for your patient. And so there's a video here that kind of shows a good technique. So let's keep going here and talk about, now this is the slide that you'll get if you purchase the machine. They'll kind of show you like safe start settings. I'm going to share with you my specific settings now that we're a little bit more experienced with it. And I don't necessarily agree with everything on this slide. It says, the blue area, do not treat or treat with extra caution. Well, I think you can treat the entire face and body with this. You just have to do it the right way. And I think they do this just to make sure that you don't have any issues when you're first starting this. Up in the temple region, you really want to get a little bit more superficial. And you don't want to go as high of energy settings because it's thinner here and you're on a bony surface. In the mid face and around the jowls, the neck, the submentum, you really can go to town with the Morpheus, and it's quite good. This is a nice video. If you guys do have a Morpheus showing that nice technique so that you don't get muscle contraction, that was far more of an issue with the Fractora than it is with the Morpheus, but this is still will make the experience far more comfortable for your patient. Notice the pinching up of the tissue, so it's away from the muscle, it's away from the nerve. So this is a really nice way to make it more comfortable. So in terms of stacking, I want to talk a little bit about stacking. I actually don't stack my pulses anymore. I prefer allowing the skin to thermally relax and then coming through again with another pass. And so, yes, it might take a little bit longer to do that, but I found that the downtime and the complications, which, prolonged redness and those types of things or breakouts are a lot less when I don't stack my pulses. I know some would disagree with that, but that's just what I found to be great in my practice. So again, in terms of endpoints and what you want to do this, if you're doing the light protocol, you do want to see some erythema. When you've kind of gone over the areas, you should see a nice uniform distribution of the redness and of the dots. If you've missed any areas, you'll see that it's a little bit white, so you'll need to kind of go over that area again, because your patients will look at this in the mirror and say, oh my gosh, you missed the spot here, here, or here. And so, you have to be kind of focusing to do that because it's a little bit of a delay with the erythema. So when I do my first pass, I'll look, and if I've missed any spots, then I'll come back and make sure that I get those on the second or the third passes. So this is how you can get really even treatments. I do believe in post-cooling. So post-cooling could be a cool, like an ice mask afterwards or a Zimmer chiller, especially if you're treating type 3, 4, 5, or 6 skin. I think post-cooling is really important for anything that we do that heats the skin, even if we're sparing the epidermis, to minimize the chance of post-inflammatory hyperpigmentation. Okay, so post-cooling is really, really important. In terms of what we apply on the skin afterwards, I like doing either platelet-rich fibrin, which is what we use in our practice, or if you have platelet-rich plasma, you can use that, so PRF or PRP. We also really like the elastin skin nectar as a kind of a healing emollient. And you do want something to apply onto the skin. Remember, you have these channels now, so that's actually a great opportunity to introduce growth factors, whether it be their own growth factors through PRP or PRF, which is preferred. If they don't necessarily want to do that, or if it's an upcharge and they don't want necessarily spring for that, then you could use kind of a nice growth factor serum of your choice. So here is my secret sauce. Okay, this is my cheat sheet, and this is what I've come to after a couple of years now of using the Morpheus, and I want to share this with you. So light protocol, this is somebody looking for just maintenance. They want to maintain nice skin, or they may have done something more aggressive in the past, and they don't really have more than a couple, 3 days of downtime. This is typically the protocol that my extenders are using. And so topical anesthetic is usually sufficient, but do give it the 45 to 60 minutes of topical anesthetic for your patient's comfort. So usually for the mid-face or for areas that have thicker skin, we will use the face setting, which is 3 millimeters of depth, but only 10 to 20 energy. Okay, and so you can use that on all the different skin types. Okay, so up to type 6 skin. And then I'll go a little bit higher on the energy for type 1 to 3 skin, okay, so 20 to 30, 2 passes. Then I'll dial it to 2 millimeters depth, and I'll only give it like 10 energy if it's darker skin, type 4 through 6, 20 to 30 energy on types 1 through 3, 2 passes. Now, if somebody has fine lines or fine perioral rhytids and they're a type 1 through 3, then I'll actually put on my resurfacing tip once I've done the regular tip and give that a couple of passes as well. I like applying platelet-rich fibrin or PRF right afterwards, and then we also send the patient home with a refrigerated elastin skin nectar to use over the next 48 hours. We ask them not to put any makeup on because those holes are going to be open for a little while. Post-cooling is really, really important. Now, what I'm typically doing is the aggressive protocol. So the aggressive protocol is where we're really going to town. And why would we use the aggressive protocol? If somebody has really bad acne scarring, if somebody's looking for facial slimming, so they want to slim their nasolabial folds, they want to treat this little jowl compartment, they want to treat their submentum, or if I've already done face tight or AccuTite, they're tumesced, they're numbed, that's really that's when we'll pull out the aggressive protocol. So for the aggressive protocol, I do use nerve blocks. I like infraorbital nerve blocks, mental nerve blocks. You can do supratrochlear and supraorbital if you're doing the forehead. You can use those nerve blocks as well. You just do a little lidocaine, just like you're injecting Botox in the glabella, and that numbs most of the forehead. I will use 4 millimeters of depth for fat remodeling and skin retexturing, 40 energy. Okay, that's for my, you can use it for all skin types, 2 to 4 passes. Then I'll switch to 3 millimeters depth. This is all with the same tip, by the way, on one patient. 3 millimeters depth for, again, for more fat remodeling, but now we're getting closer to the kind of bottom part of the dermis, the reticular dermis. And so we're going to be treating that as well. So that's going to give us some nice dermal remodeling in addition to the subdermal remodeling and fat loss, if we want fat loss. And actually, it's a really good point. Patients will come and say, I don't want anything that's going to lose fat. You'll have some patients that say that, and they're afraid of RF, or they've heard of other modalities like Ulthera or HIFU and have seen issues with fat atrophy. The nice thing about Morpheus is that if you use the light protocol, you're not going to have any issues with fat loss, because if you're only staying 2 and 3 millimeters, then the chance of you having fat atrophy becomes much, much less. So getting back to the aggressive protocol, again, 3 millimeters, 40 energy, and I like to use 2 to 4 passes for that. Then I'll go to 2 millimeters, and then if I need the resurfacing tip, if I'm doing rhytids around the eyes or around the mouth, then we can do the resurfacing tip as well. But again, that's only type 1 through 3 skin, because I don't want type 4, 5, and 6 skin to have too much heat on the skin, because that will definitely lead to post-inflammatory hyperpigmentation. The other thing that Morpheus is great for is for malar bags. So malar bags are one of the most difficult things to treat. And so I often will just use Morpheus alone. If the malar bag or the festoon is really bad, I'll usually do Accutite under it first, and then I'll do my festoon treatment. So I go 4, 3, 2 on festoons, 4 millimeters depth, 3 millimeters depth, and then 2 millimeters depth, usually at 480 energy, 2 passes. And because it's a small area, it doesn't take a lot of pulses to finish it off. Usually it's only like 10 pulses per pass. So it's not a lot to treat the area. And I've seen amazing results with festoons, and it's one of the only things that I've found to treat festoons. If you think about it, a festoon or a malar bag is an edema pocket, okay? And so if you're ablating the edematous pocket with radio frequency with coagulation, then that's really kind of the answer. And again, if it's a severe festoon, it might not, be appropriate. But for mild to moderate festoons, I found this to be very, very effective. So I'll get a little bit into the marketing. We've done some marketing ourselves. The company has been great about marketing and doing direct to consumer through different media channels. We did something with Extra.
Speaking of The Bachelor, we first met Michelle Money hoping to find love with Brad Womack, but now this striking reality star is hoping to redefine her jawline thanks to a new beauty treatment.
Like most women, 39-year-old actress and former Bachelor contestant Michelle Money wants to look and feel her best.
So that's the message, right? So who's our patient? This 39-year-old, doesn't have to be an actress, but this is the patient who is just starting to transition to see some sagging of their face. They may have some issues with previous acne scars. They may want some, very subtle jawline contouring, whatnot. So this is the type of patient that this is the message for. So this is not like the 60, 70-year-old, and of course it works for that, but this is really where the market has emerged of this younger generation of people that are looking for subtle facial rejuvenation. We did a combination Morpheus and Accutite, but the Morpheus was really the kind of, especially for around the eyes, really the key. And actually the Morpheus was nice I did some subdermal remodeling for her nasolabial fold. So these are the results that we achieved for Michelle. And just on a side note, Michelle Money, if you guys follow her on social media, her daughter was in a bad skateboarding accident and is in a coma. And so, just seeing this and mentioning her, just my thoughts and prayers are with her and her family, if you guys know her. But anyways, back to this. So the Morpheus, again, the resurfacing tip can be really nice for rhytids around the eyes. We do a lot of this in our practice. We'll give promotions and things to incentivize people to come and try these treatments out. But our patient satisfaction with Morpheus is like through the roof. It's well over 90%, and that makes me happy, and that makes our extenders happy because our patients are happy. This is another area that is really huge. These little jowls in this area is such a tough area to treat, and so Morpheus is really promising for that. Again, Morpheus alone can be used. I will often combine it with Accutite, like you see here, but I've actually been doing more and more just Morpheus treatments because the Accutite, you can only deliver a little bit of energy there because it's such a small area. But the Morpheus alone is fantastic for this.
Microneedling to go through the skin just on that area to give the skin some tightening as well. So this is kind of from below and from above to really maximize getting rid of the fat and then tightening that network under the skin, that dermal septal network, and also the skin itself. So we can adjust it to the depth of penetration between 2, 3, and 4 millimeters of depth, and we can precisely put how much energy we're going to put. So this area is already numb, so we're going to go 4 millimeters here. So you can see that I precisely targeted the poof there, and 4 millimeters is definitely enough depth to get not only through the skin, but just right under the skin as well. So again, we're just going on the numbed area, a little bit of overlap, and that's it. So now the combination of Accutite and Morpheus8, over the next 4 to 6 weeks, we're going to expect significant tightening and reduction of this area that will actually last for years. Good.
These are the types of videos that we create. We'll put it on our social media. We'll have it in our lobby area, in our reel. And so, but the nice thing is that patients, I mean, because of the efforts from InMode and a lot of you that are, you know, key opinion leaders and people that are enthusiastic or just active on social media, I usually don't have to explain Morpheus8 when a patient comes into my office. The whole consultation process after social media has totally changed. Everybody knows about the practice. They've looked you up. They know who you are. They know what you are. And they come in with an idea like, is Morpheus8 right for me? And they usually have a pretty good understanding of what it is. It's nice to kind of share with them some more technical details about it, but it's really great because of all the social media. The awareness of Morpheus8, I would say, far exceeds any other radiofrequency microneedling platform out there. So these are some of the before and afters that I looked at when I was considering purchasing the technology, and you guys have probably all seen this as well. You can see the improvement of the nasolabial folds there. Okay, and I want to show you guys some of my own before and afters. Here you can see from our moderator, from Dr. Diane, some real nice results in the perioral region. I mean, the whole remodeling is really the key here. We used to think of radiofrequency microneedling or microneedling just as for skin texture, but the remodeling is really kind of the paradigm shift with all this. So these are my patients now. So I told you about the festoon treatment. So this patient came to me, she's Latina, so she has Latin skin, you know, type 4 or 5 skin, and has this little malar bag here, this festoon, and she had tried so many different things to try to improve that. She actually purchased a package of 3 Morpheus8 treatments, and she didn't come back after her second one. So she was so happy, after, and this was after the second treatment here, that we did not even have to finish the series. And this has been well over a year since I've seen her. And so again, you know, this is not the biggest malar bag in the world, but what else are you going to do for that? You're not going to do fillers. I wouldn't laser resurface her skin with a full ablative resurfacing, because that would really lead to a lot of potential PIH. And so radiofrequency microneedling is perfect. We saw a video of this before and after, and so you can really see the improvement of the skin texture. I will often, actually, my favorite combination is to do hyperdilute radius with PRF under the neck. So the radius is mixed with lidocaine, saline, and PRF. I do that with a cannula. The whole neck area then becomes numbed, and then I'll go to town with my Morpheus. And that's kind of really nice, because then the patient's totally numb anyway. And that combination of that radius deep, the diluted radius with platelet-rich fibrin, and then the Morpheus through the skin, that is a really awesome combination. You can see a really nice improvement here with her neck after the Morpheus treatment. You see I went down a little bit on the energy because she is a type 5, you know, type 4, type 5 skin. And I don't double stack anymore. I was then. This is a couple of years old. So again, combining modalities. So this is a patient I did Accutide on, but I always do Morpheus as kind of like an insurance policy to, again, to really tighten the skin. So I did Accutide. You can see the really nice subdermal remodeling, which is probably mostly Accutide, but the Morpheus, in addition to that, really kind of helps crisp up the jawline and the submentum when combined with Accutide. This is before I had the Morpheus. This is a patient I did a facelift on, and I did Fractura around her mouth, and you can really see the improvement around her mouth. So, you know, imagine if I did this heroic facelift, and you could see a reasonable facelift result, but then she was left with all these lines around her mouth. You know, the combination of the two is really the key. So this is all facelift result out here on her face and her neck, but around her mouth, that's not a facelift result. Okay, that's just the radiofrequency microneedling. And so the two together are really synergistic. So if you're a surgeon and looking at this, this is a fantastic way to combine modalities. Okay. Okay, so let's look at some of these patients we treated in those videos. So this is 3 months after we treated that gal for this area, kind of her jowl poof area, with the combination of Accutide and Morpheus8. Again, I'm shifting more and more to just Morpheus8 for these areas, because the effects of the Morpheus8 for something so superficial here are pretty good. And so, Accutite is not necessarily something that you need to add. And so you can see some nice improvement of this area, really tough area to treat. I did 4 and 3 millimeters, so I did 20 per side, 40 pulses at 30 energy there. Okay, and you can just see like the improvement around her mouth. Okay, so let's look at some other patient. This is another patient 3 months after the treatment again of this kind of perioral region. This area is just so hard to treat with any other modality. We don't even get that with facelifts, and so having something like this is fantastic for slimming. This is now a year later, and you can really see the improvement. And as you guys probably know, the effects of radio frequency, particularly when you're going deep enough, will improve up to a year. And so we do usually do a series of these, and we'll give 6 to 8 weeks for thermal relaxation. But the effects of even the first time you do this will improve for months to a year. That's been proven with many, many studies. Here's another patient a couple of months after nasolabial fold slimming and also the corner of the mouth slimming. Okay, so you can see some improvement there. And you really, this area here, I think you can see my cursor, but if not, I'll show you. This area here is really fantastic, and also the nasolabial fat compartment is fantastic to treat with Morpheus8. Okay, this is 2 months, and this is a year. So look at 2 months. So 2 months, you see, some improvement, but you still see these little pooches here. Now look at a year. At a year, it's just a lot smoother. It's a lot, it's gone down quite a bit, and you can see that the bulk of her nasolabial fold it doesn't catch the light as much. And so that's the kind of subtle remodeling that we like to see. We don't want to atrophy anyone's face here. That's not the point. It's really about targeted, specific heat to create facial remodeling. Okay. This is actually just a month after a younger patient with facial remodeling. You can I'll show you the animation here. You can see the nasolabial, how it's decreased in bulk. Okay, awesome. So that's all I have for the presentation. I believe Dr. Diane has been accruing some some questions that I'd be happy to answer for you guys.
Awesome. Well, thank you so much. Thank you so much, Dr. Karimi. That was awesome. I always learn a lot from you. So really appreciate it. Let me ask you, as the questions roll in, they're going to send us some questions here. I have a couple of questions for you. People commonly ask, are there particular patients that have more pain than others? Or I know you use a topical and sometimes, nerve blocks and things like that. But do you find that certain patients have more pain than others, or is there any kind of reliable way to figure that out?
I'll do if it's a new patient, I kind of will get to, I'll ask them what their experiences is with other injectables, like how painful is it when you get Botox or fillers, and to kind of assess their pain tolerance. And patients usually have a pretty good idea of what their pain tolerance is. We have the occasional delusional patient who's like, oh, I have a really high pain tolerance and I have 0 pain tolerance.
Right.
And so we try to kind of ascertain that in the beginning, and we're usually pretty good at assessing people's pain tolerance. I'm pretty liberal with nitrous in our practice, and when I'm here, I allow our extenders to offer nitrous to their patients. It's really safe, and a lot of people prefer it over Valium or narcotic, things that make them not be able to drive, or things that will give them a hangover. And so nitrous is our friend.
Right. Yeah, I agree with you. We use it as well, and we really like it a lot. I agree with everything you said. I mean, I think for us, Morpheus is a great standalone as well as additive treatment, like when you do Accutite and things like that. Let me ask you, do you typically go deep to superficial if you're doing multiple passes at deeper depths, and why? Or do you go superficial to deep, or what's your rationale?
So I always go deep to superficial because I want to get the deep heating first. I feel mentally, if I'm going superficial to deep and I'm coagulating an area and then I go through it again to get deeper to it, then I may not have as controlled of a heat response. Whereas if I'm going deep to superficial, I like to go deep and then heat it below it, more superficial to it, and then I can cut off how superficial I want that depth to be by my settings and by my energy levels.
Great. Yeah, I agree. Same as well. Have you seen any complications? I know a couple. I've done many, and I know you've done many. Some, I've seen not personal colleagues, but I've seen some people complain of these little, marks in. Or have you seen any issues with it, and any tips on how to avoid it?
Yes, so the complications I've seen are typically just prolonged erythema or prolonged swelling. That's when I've done my aggressive protocol. But of course, there were only complications when I didn't explain to the patient how long it was going to take them to heal. So setting the proper expectation of the healing. In terms of an actual complication where you see the dots for, beyond the treatment, I've had one patient who was like a type 5 Asian patient we were able to see a little trace of the treatment, and I believe this was with Fractora, if I'm not mistaken, for like a month. And so that's kind of the worst thing that I've seen. Other complications, patients have had breakouts, and I attribute that to the patient not following our instructions by maybe applying makeup or some kind of comedogenic barrier onto their skin. And then if they do have a breakout, I've just treated that with doxycycline and haven't had any issues.
Right, same. I would say, I actually agree completely with your answer, and I think that for me, I actually had a patient, I think he was Latin American, young guy, that I did a pretty aggressive resurfacing on. So the resurfacing tip can, if you do it aggressively, it can be a little more sensitive because you're superficial, and it can, it's basically a fractional resurfacing using radio frequency. So you can have, week and a half, 2 weeks of erythema. Sometimes we put them on, I haven't really used Medrol dose packs, but I'll give them Benadryl, if they have a kind of histamine reaction. But I know some people do a Medrol dose pack. Let me ask you this, Kian. Have you used Morpheus for things other than kind of aesthetic? Like, I know some people use it for hyperhidrosis or acne, things like that. Have you tried that at all?
So I haven't used Morpheus for active acne, although I think it would be a really great use of it. I like microneedling for active acne because I see acne as little micro abscesses. And so I like to be able to get into those abscesses with microneedling and then apply either a topical antibiotic or platelet-rich fibrin or platelet-rich plasma to it. I would love to see protocols on, I've seen a lot of protocols on acne scarring. I'm not too familiar with the protocols on acne, so maybe you can enlighten us on that. For hyperhidrosis, radiofrequency works phenomenal. And so, for axillary hyperhidrosis, with usually in combination with FaceTite or Accutite, I think Morpheus is fantastic. I haven't used Morpheus alone for axillary hyperhidrosis, but I feel like it would be a great treatment.
Yeah, we're actually increasingly using it for kind of off-label uses. So, the dermatologists have kind of brought to light the use of fractional radiofrequency for acne, even active acne. And the nice thing about it is it'll also provide you with some resurfacing. It gives you the aesthetic value of the Morpheus as it is, and then it also does some acne treatment. So usually we do doxycycline for 2 weeks, and then the same kind of Morpheus, aggressive Morpheus treatment you talked about. For hyperhidrosis, it actually works pretty well. Axillary, I haven't done anything as wild as palms or anything like that, but I know some people are trying it. Yeah, I know. It's not, but it does work. It definitely stuns those glands. So let me see. We got a few other questions. Let's see here. As far as doing it in combination with an Accutite, for example, is there anything you do differently? Are you concerned about, vascularity, lymphatic flow, complications when you combine radiofrequency modalities?
So anytime you combine this, especially with something like Accutite or FaceTite, you're just going to have a little bit more healing time with it. And so the Accutite and the FaceTite is really where most of the swelling and the healing is going to come from. The Morpheus itself, I don't think really prolongs the healing time that much from it. I haven't had any issues with lymphatic flow. And in fact, I really love this for patients that have had previous work, either a facelift or a neck lift or or liposuction, they have irregularities. By putting the even heat profile both below and through the skin, that actually has improved that situation a lot for patients. So this has been a really great rescue for patients that have had issues with lymphatic flow from some other procedure in the past.
Right, I actually agree with that. We actually did a study looking at indocyanine green and mapping out lymphatics as well as vascular perfusion with combination treatments. And I agree with you. You know, you actually get improved lymphatic flow because of the increased VEGF and some of the other growth factors that radiofrequency is known to increase. Let's see some more questions here. Do you ever combine this with facelift or an excisional procedure?
Yes. So the easy combination, of course, is, you know, you do your facelift, you have your flaps elevated here, and then you do the radio frequency, you know, like the Morpheus around the eyes or around the mouth. And so if in talking in terms of radio frequency and microneedling, that's kind of a gimme. And I'll even do kind of the whole face. Now, if I'm going over the flaps, with this, just like with lasers, I will only do like one pass. I'll do less aggressive settings, just because to limit any type of issue with the skin healing. But when I'm doing, like, if I'm doing central face, then you can go to town during a facelift, and that's actually the time to go to town, because those patients are going to be recovering for 1 to 2 weeks anyway from their surgical procedures.
Great. One more question here, which is good. What's your post-treatment protocol in terms of sun exposure? You know, are you using things like elastin? I think you mentioned elastin. What's your typical protocol for that?
So, so on the day of, post-cooling is a must. So 10 to 15 minutes of Zimmer chiller, and we have these little kind of like biocellulose recovery masks. We'll be applying platelet-rich fibrin, PRF, on all the areas that have been Morpheused. Then the patient leaves with the elastin nectar, which is kind of a very thin kind of growth factor serum that they use, and we have them use that on all the Morpheused areas 2 to 3 times a day for 48 hours. After 48 hours, then we allow the patients to get back to their normal skincare regimen with moisturizers and whatnot. We have them avoid a retinol for about a week, just to allow their skin to recover from the Morpheus procedure. And then we really emphasize not just sun exposure, but heat exposure for about 2 weeks, because even heat in the absence of sun can lead to post-inflammatory hyperpigmentation or triggering of some adverse event.
Mm-hmm. Yeah, you know, I think a lot of people have different post-treatment protocols. I personally don't cool afterwards, but you know, what's interesting is if you look at the Morpheus energy with a thermal camera like the FLIR camera, that heat actually stays in the tissue for a while after treatment. So you know, some people like to cool for patient comfort and things like that, and some people don't, so that you kind of maintain the volumetric heating. But you know, I think that's still being kind of sorted out, and nobody truly knows exactly what the right answer. Here's a good question. Would you do IPL at the same time?
Yes, so I have done IPL at the same time as Morpheus treatments, and so the IPL is really going to be a very, very superficial treatment. Now, I wouldn't do IPL and resurfacing tip on the same area at the same time, but I wouldn't have any issues doing like a deeper Morpheus treatment, 3 or 4 millimeters, and then doing an IPL for superficial skin issues. And we've combined actually Lumecca with Morpheus, and I haven't had any issues with that.
Mm-hmm. Yeah, same. You know, I think when you do deeper depths, you just have you don't see it on the skin surface right after, so it's pretty much as if you didn't do it. Another good question here: do you use Morpheus for filler complications? You know, some patients have swelling, chronic swelling after filler injections, and you talked about malar edema, malar bags.
That's a great question. In fact, I do use Morpheus not only for filler complications, but for fat transfer complications. So I've had patients come to me with fat transfer done wherever, and they have these issues around their eyes. or if they've had filler and the filler is kind of created a malar bag or created a festoon, we use Morpheus actually to treat that, and it's a fantastic treatment. And again, I use my festoon protocol. I will go all the way to 4 millimeters, but I make sure I want to get every depth from where the filler is to more superficial 4, 3, and usually 2 millimeters.
Yeah, we're the same. I couldn't agree more. You know, patients go crazy when they have filler complications, malar edema. It's really bothersome, and as you said, there's no good solution to it.
Right.
You know, so let me ask you 2 more questions here. We're getting a lot of good questions.
Okay.
Have you done it on men, and have you seen any hair loss?
So I have done it on men. I have not seen hair loss, but again, when I'm treating a bearded area, I am a little bit more conservative with my settings there. If you were to get, and I do counsel men on shock alopecia, and I also counsel them that it's something that if it were to happen, should regrow in 3 to 4 months.
Mm-hmm. Yeah, same. I've done plenty of men. I haven't seen issues with it personally. Morpheus actually, I think, has been from a complication standpoint extremely safe. I mean, we've gotten quite aggressive, going up to energies of 50 in 2-mest patients and dark skin patients, and it's actually been totally fine. Okay, last question here. There's so many good questions, hard to pick. As far as someone here is asking, it's a good question, number of pulses on average for like a face. What would you say that is for you typically?
So again, it depends on the light versus the aggressive protocol. So for a light protocol, and I kind of will show this with my extenders, there really shouldn't be less than 100 pulses. I mean, you want to be between, I think, 100 to 200 pulses. On my aggressive protocol, it'll be like 200 to 300 pulses if I'm doing a full face, and especially if I'm doing dermal remodeling.
Mm-hmm. Yeah, same. I mean, it depends. It really depends on how aggressive you want to be. I've gone up to 1,000 pulses even if I'm doing triple stacking, 50% overlap. So it's there's a whole range. I agree with that.
Yeah.
Okay, last question. Last question. Someone's asking, how long does it take on average for you to do like the aggressive protocol? What's your average start to finish?
Actually, if I've done field blocks, or especially if I've done a little bit of a regional block, not long at all. It takes me under 10 minutes.
Yeah, exactly. It's a very quick treatment. It's awesome. So
yeah, which is great for a surgeon because we tend to be a little impatient.
Yeah. No, it's always, as long as it's working faster, more efficient is better, as we say.
Exactly.
Well, thank you so much, Dr. Karimi.
Yes.
It was awesome. I always learn so much from you, and I always enjoy your presentations.
Thank you, Dr. Diane. Great to see you, and hopefully we can all see each other in person sometime soon.
Yeah.
All this craziness
exactly.
is over.
Exactly.
All of you, thank you for watching. Be safe out there, and we'll see you all soon.
Thanks so much.